Good evening. I'm Terrace Kennedy, President of Virginia Nurses Foundation, and I would like to welcome each of you to the 2020 Virginia Nurses Foundation Gala. Thank you for tuning in this evening and for your incredible support of Virginians this year. The VNF was founded in the mid-'80s and is committed to improving the health and health equity of Virginia's communities by developing an educated, diverse, and inclusive nursing workforce through leadership development, research, innovation, and recognition. At this time, I would like to recognize our partner, Riverside Health System, who made tonight's events possible. We cannot stress enough our appreciation of your support, and I would like now to introduce Riverside CEO, Bill Downey, to say a few words. Thank you for joining us, Bill.
Welcome, and on behalf of Riverside Health System and all of our outstanding nurses across Riverside, we'd like to welcome you to tonight's Virginia Nurses Foundation Gala. For over 100 years, Riverside has been providing great nursing care, starting with our College of Health Careers, with nurses in every setting imaginable across the continuum: outpatient, ambulatory, inpatient, behavioral health, post-acute, lifelong health, and in home care services. We are fortunate to have such an outstanding group of nurses at Riverside and across the Commonwealth of Virginia. It has been a most unusual year. As my daughter recently pointed out to me, who would have picked on their 2020 bingo card, global pandemic? But I think we could always say that one of the things you can always predict is nurses will be at the heart, at the center of what we do and how we provide care. So as we come to the end of 2020 and the year of the nurse, we would like to again congratulate and say thank you to nurses in every setting across the Commonwealth of Virginia. And we would especially like to thank and congratulate tonight's winners. Have a great evening.
Good evening, everyone. I'm Janet Wall, CEO of the Virginia Nurses Foundation, and it's great to see you all here this evening. Thank you again, Bill, and to Riverside for partnering with us to produce such a fabulous event. And thank you, too, to our foundation trustees, who I'd like to recognize at this time. In addition to our wonderful president, Dr. Terrace Kennedy, we have Vice President, Dr. Frank Brown, Treasurer, Dr. Sherry Wilson, Commissioner on Resources and Policy, Dr. Jennifer Martin, Commissioner on Nursing Practice, Aaron Keister, community members, Billy Harper, Dipti Ramnarain, and Blen Abdi, trustees at large, Dr. Patty McHugh, Dr. Vivine McDaniel, and Dr. Phyllis Whitehead, VNF immediate past president, Terry Haller, and VNA immediate past president, Dr. Richard Dean Benjamin. Despite the pandemic, and in part because of the pandemic, VNF's board has been hard at work ensuring that Virginia's nurses and our communities get the programs and supports they need to thrive. Our mental health roundtable, composed of about 50 nurses and behavioral health professionals, continues to address issues tied to stigma, access to care, and integrated care. While we believe efforts focused on mental health are always important, we know that they are even more so now, given the social, economic, and health climate. In the past few months, and thanks to the generous support of CCA, a national HR consulting firm, we were able to host 5 webinars for nurses focused on emotional first aid, managing stress, and building resilience during and after the pandemic. And because this year's holidays may be particularly difficult for nurses, we will be holding one more free webinar with facilitated discussion on December 10. For the past several years, the foundation has partnered with the Virginia Hospital and Healthcare Association, the Medical Society of Virginia, and the Virginia Department of Health to convene an innovative, multi-month, interprofessional, team-based learning experience that teaches collaboration and leadership through hands-on problem solving. We're excited to share that most recently, the Virginia Pharmacists Association has joined our partnership. We continue to receive rave reviews from participating teams and are now preparing to begin our 7th cohort. Last year, I'd shared with you that we were working with nursing leaders from across the Commonwealth to create a year-long program for new and emerging leaders called the Nurse Leadership Academy. I'm excited to tell you that we have finalized the curriculum for the Academy, And we'd hoped to welcome about 50 nurse fellows to the program next month, COVID has forced a postponement to October 2021. We've had tremendous interest in the program from nurses and employers alike. Be on the lookout for more information about this exciting new program in the months ahead. I'd like to take a moment to mention our efforts in the area of diversity. The foundation incorporated some new changes into the bylaws, including our new diversity statement, which is to actively foster a climate of diversity and ensure equity and inclusivity in the field of nursing and in the communities we serve. This statement was developed by the VNA-VNF Diversity, Equity, and Inclusion Council, which is also working with nursing leaders from across Virginia on strategies to achieve a workforce that better mirrors the diversity of its communities. Several members of the council are also assisting with the planning of our 2021 joint VNA-VNF Spring Conference, the focus of which will be creating a multicultural foundation for nursing. I'd also like to take this opportunity to remind you of the Nurses Change Lives license plates that many of you are now seeing on the road. Not only does the license plate look great, it also provides needed revenue to grow our foundation's scholarship and education programs. They are available for purchase on the DMV website.
Before we move on to the celebratory part of our evening, we ask that everyone join us in a moment of silence and reflection for the more than 240,000 people who have died because of COVID-19, as well as their loved ones, friends, and communities.
Thank you, Janet, for sharing those highlights with us. It's exciting to know that we are still able to accomplish such milestones despite being in the middle of a global pandemic. Now, on to the main event, our 2020 Year of the Nurse Awards. Who could have imagined that when the World Health Organization declared 2020 the Year of the Nurse, we would be thrust into a global pandemic? During this year, nurses have been essential to fighting the COVID-19 pandemic in so many ways. You have not only been on the front line of providing care to the sick and working to keep your communities and patients safe, you've also provided support and innovative ideas and compassion. You have done this in the way nurses often do, quietly, competently, with a focus on the needs of your patients and clients. You've worked long, hard hours without expecting recognition or accolades. But we think that nurses deserve both of these, especially this year. That's why we're pausing tonight in the midst of a crisis to focus on celebration. We're going to tell you about 20 Virginia nurses who have gone above and beyond the call of duty. Tonight's winners have risen to the unprecedented challenges facing the nursing profession and are a true inspiration to all of us. Mother Teresa once said, "I alone cannot change the world, but I can cast a stone across the water to create many ripples." Each of our finalists have proven themselves to be inspirations, not only to their units and facilities, but to the nursing profession. We are thrilled to recognize their great work. First, I'd like to recognize our honorable mention nurses. Michelle Davidson of Leva Psychiatry, Jan Kirby of VCU Health, Allison Knapstein of VCU Health, Monique Lowry of Centera Obici Hospital, Allison Montpettit of VCU Health, Erica Nichols of VCU Health, Sarah Noel of VCU Health, Kathleen Russell Babin of Innova Health System, and Bonnie Workman of Riverside Regional Medical Center. Please give our 2020 Year of the Nurse Award honorable mentions a virtual round of applause. And now, the moment you've all been waiting for. Without further ado, here are the winners of the VNF 2020 Year of the Nurse Awards.
Our first winner immediately stepped up as a role model for his peers at the beginning of the pandemic. For the past several months, he has shown compassion, patience, leadership, and positivity. He advocated for COVID-19 patients for extended weaning from the ventilator in lieu of tracheostomy tubes, recognizing the long-term implications for these otherwise healthy patients. Due in large part to his advocacy, extended ventilator weaning has been successful in multiple patients who have been very safely discharged home. He is a true hero, providing exemplary care on the front line of the COVID-19 pandemic. Congratulations to Ben Kleins of VCU Health.
Hi, my name is Ben Kleins. I work in the VCU Medical Respiratory ICU. I wanted to start by saying a huge thank you to the Virginia Nurses Foundation for this amazing award. 2020 has certainly been a year full of many unexpected challenges, and nurses all across the country have stepped up in a huge way. I want to give a big shout out to my coworkers in the MRICU. Every single one of them has been with me throughout this entire process, learning on the fly and adapting every single day to the challenges that arise. I also want to give a huge shout out to my friends and family for supporting me throughout this year. I certainly could not have done any of this without them. Thank you again. Stay safe, everyone, and happy holidays.
Our next winner was asked in spring 2020 to serve as the George Washington Nursing School representative for the university pandemic planning team, and quickly rose to a leadership role as co-chair of the health and wellness team. She was tapped to start up a testing site in Ashburn, Virginia, to test 550 people weekly, including 430 nursing students, faculty, and staff. And in only 2 weeks, she had to determine resource needs and staffing plans, hire staff, determine faculty needs with the dean, assure a student nursing education and training plan, and also integrate the testing center processes with the student nurse experience. Congratulations to Dr. Karen Drenkard of George Washington University.
Hi, I'm Karen Drenkard, Associate Dean at GW School of Nursing. I just want to say thank you to the Virginia Nurses Foundation for this award and celebration, and congratulations to the fellow award winners. I want to thank Patsy Deo for nominating me and my dean, Dr. Pam Jeffries, for the opportunity to stand up and run a COVID surveillance testing center, keeping our students safe and allowing them to progress and graduate and work in the Commonwealth of Virginia. I never expected that this would be my work, and I never expected to win this award, so thank you so much. I'm very grateful.
This award recipient designed and produced prototypes of see-through masks for a deaf husband to be able to read nurses' lips while his wife was in the hospital delivering their first child. When the nurses came in with his first mask, the couple was taken aback and the husband began to cry. He mentioned that often in his life, people don't take the time to try to communicate with him or dismiss him because they don't understand. Each prototype that arrived via a new nurse, the husband would discuss ways it could be improved, and as a collective team, they arrived at the mask now known as Will's View. Congratulations to Lori Holloman of Centera Princess Anne Hospital.
Centera Princess Anne Hospital is very proud to give this award to our very own Lori Holloman from the Virginia Nurse Foundation 2020 Year of the Nurse. Woo!
Our next winner immediately volunteered to work a drive-through clinic serving the veteran population at the start of the pandemic. She did not hesitate to put herself at risk when COVID struck her city and facility. She was one of the first volunteers, in fact. She further volunteered to respond to the COVID-19 crisis outside of the Richmond area. She deployed to Spring City, Pennsylvania, where she selflessly served at a veterans skilled nursing community living center 5 weeks in conjunction with the disaster emergency medical personnel system, where she took care of 25 COVID positive patients. Congratulations to Adina Mahini of Hunter Holmes McGuire VAMC.
Good evening, ladies and gentlemen. My name is Adina Mahaney, And I want to thank the Virginia Nurses Foundation and the Virginia Nurses Association for this award. I am deeply honored and humbled to receive this recognition for my work. What makes me prouder is to be able to share this award with 19 other deserving nurses. So many people have and are doing amazing work. But despite all the dark and difficult moments we have faced this year, perhaps most importantly, I have learned that crisis often brings out the best in people, sometimes at a greater personal risk to themselves. I believe being altruistic doesn't cost anything or need an explanation. It's simply an unselfish act for the good of others. Finally, winning this award would not have been possible without the inspiration I have received from my colleagues, for whom I have the deepest respect. Thank you again for this honor.
Next, we're excited to recognize a nurse who took 2 college students into her home and cared for them like her own at the beginning of the pandemic. She worked on the front line with nurses to help train them in infection control measures to ensure safety in the hospital environment. And while she was helping hospital staff learn the infection prevention techniques, she was also teaching those at the house and the neighbors next door. In the community, she made sure that masks were provided to everyone she met if she saw that they did not have one. In May, in preparation of Nurses Week, she went above and beyond by creating more than 100 handmade Nurses Day cards for nursing staff at their hospital. Congratulations to Elisa Mangosine Lemon of Riverside Doctors Hospital, Williamsburg.
Hi, my name is Elisa Mangosing Lemon, and I'm a registered nurse in staff development with Riverside Health System and Riverside Doctors Hospital, Williamsburg. At Riverside, our mission statement is to care for others as we would care for those we love. And that's kind of how I live. I do what I do as a nurse and nurse educator to make a difference for someone else. I'm really very honored to be named among nurses in Virginia and want to say thank you to the Virginia Nurses Association and the Virginia Nurses Foundation, for they have a strong tradition of celebrating the achievements of exceptional nurses. Thank you.
This award recipient took on the role of the lead COVID clinical nurse specialist with infection control teams at her facility and developed policy and procedure for how to care for patients and frontline workers. She is currently developing a hybrid unit that will facilitate an ICU, PCU, and med-surg for COVID patients run by specialty trained nurses who can smoothly facilitate changing needs. The construction of this unit allows healthcare providers to access pumps from outside of the room, so caring for patients is not displayed by donning gear to change a pump setting, thus improving patient satisfaction and provider safety. Congratulations to Heather Mayberry of Centra.
Heather's been nominated and selected for the VNF Nurse Excellence Award. Her nominators cited Heather's extensive support of the nurses and patients within the COVID populations at LGH as an example of her worthiness. Heather has been an integral part of providing boots on the ground support to the nurses within the COVID unit since March, rounding on the units and collaborating on meeting the patient's unique needs. When the hospital identified and developed a plan for cohorting these patients, Heather played an integral part in the development and implementation of an orientation plan. When the unit opened, she contributed to the team by a physical presence in the unit to support newer staff and smooth the transition from their comfortable to their new location. Support included not only hands-on patient care, but also locating equipment and supplies. To quote the nominator, "Many of us receive praise for being frontline nurses, but we stand confidently on the shoulders of our CNS and infection control teams. I know going into this dangerous war with COVID, and even on days when we are combating our more familiar disease processes, that both the patient and I can take comfort in the fact we have leaders like Heather who have paved the way for us to take on this fight." Heather, congratulations on receiving this acknowledgement of your work.
Congratulations, Heather.
We're pleased to recognize a nurse who serves on the Virginia Governor's COVID-19 Long-Term Task Force, the Virginia Assisted Living Visitation Work Group, the Long-Term Care Wellness Advisory Committee and on the 932-2020 Acts of Assembly Work Group, which is tasked with increasing the nursing workforce in nursing homes for the Commonwealth of Virginia. She is the epitome of a nurse leader, caring, warm, empathetic, selfless, and always fair. She is also an online professor at Aspen University, mentors doctoral students in Virginia and other states, and is a member of the Virginia Nurses Foundation Board of Trustees. Congratulations to Dr. Vivienne Pierce McDaniel of Aspen University.
Hello. I am sure that when the World Health Organization designated 2020 the year of the nurse and midwife, they had no idea what was going to come. I'm Vivienne McDaniel, and I am honored and also grateful to accept this award from the VNF. Thank you, VNF.
Our next winner's clinical research focuses on COVID-19 testing among underserved and vulnerable populations, address the mistrust of public health messaging and the impacts of COVID-19 testing outcomes in communities of color. She is also involved in community-engaged research to review COVID-19 testing protocols within public housing in Southern Virginia and how these protocols can be adapted and responsive to the needs of residents. She was recently appointed as co-chair for the Hampton University COVID-19 Research Task Force to help address the impact of this pandemic on vulnerable communities. She also serves on the Virginia Governor's COVID-19 Long-Term Care Task Force, which is charged with creating protocols to improve delivery of care for older adults in the state of Virginia. Congratulations to Dr. Ethelyn McQueen Gibson of the Hampton University School of Nursing. Now, this award recipient identified a telehealth vendor and implemented telehealth at 2 clinics and at home care for volunteer providers sheltering in place. She led the development of grant-funded at-home patient self-monitoring kits, which created a strategy for successful implementation of drive-up COVID-19 testing, and worked with the health department and other suppliers to ensure her team had adequate PPE. She also developed a strategy to conduct outreach and health education calls to high-risk patients and worked with her facility's medical director to develop employee health protocols to ensure employees and volunteers remain safe during the pandemic. Congratulations to Zara Morgan of Crossover Healthcare Ministry.
One of the winners for the Virginia Nurse Foundation 2020 Year of the Nurse Award. This year has been very challenging throughout this COVID-19 pandemic. It has really shown that as nurses, we always persevere. We care for our community, our patients that we serve. I work with a great team at Crossover Healthcare Ministry. We have been open throughout this pandemic. We have stepped up to the challenge, able to accommodate everyone, making sure that we are safe. I am so thankful.
Our next winner initiated the Palliative Care PRN Medication Assessment and Reassessment Project in 2019. Even with COVID-19, he continues to collect, analyze, and present data. The project's purpose is to monitor patients' assessment prior to and reassessment following pro rata medication administration of laxatives, sedatives, antiemetics, antipsychotics, anxiolytics, and hypnotics. All three interventions of education, awareness, and aggregate of individual compliance increased from 54.78% to 91.45% for assessment prior to administration, and from 44.62% to 91.45% for reassessment following administration. Congratulations to Jonathan Phillips of Carilion Roanoke Memorial Hospital.
Our next winner worked to have Zoom apps installed on all of her unit's computers. Afterwards, she sent links to everyone on the team, instructing them on how to use this technology, which was new to many of them. She also arranged simulations to ensure staff were comfortable with the platform and pushed them to become more proficient. Many of the computers did not have cameras, and upon discovering the shortages of these from the IS department, she personally purchased more cameras for the computers, thus further advancing the quality of telehealth teaching. She also frequently organizes diabetes information center sessions after work hours to teach more about the products available and their usefulness to her clients. Congratulations to Julie Pirantoni of Centera RMH Medical Center.
Hello, my name is Julie Pirantoni. I'm an RN diabetes educator at Centera RMH Medical Center in Harrisonburg, Virginia, and I was one of the finalists in the Year of the Nurse. I was so honored to have that opportunity, and I'm just so grateful and humbled by my peers that nominated me. It truly has been a challenging year for all nurses, for everyone in healthcare. Thank you again.
This award recipient goes out of her way to make sure everyone, not just the member, has their needs addressed and consistently delivers top-notch service. She cares about her team and takes the time to mentor others by not simply stating facts, but ensuring that they understand the why across a multidisciplinary process. She runs huddles, reviews performance improvement initiatives, and is always looking for a way to improve. She is one of those individuals that finds the good in things when challenges arise and always has a smile on her face. In a time where tensions are high and practice is short, she stands above her peers in her effort and dedication to the success of her team and organization. Congratulations to Akosua Poku of Kaiser Permanente.
Hello, everybody. I am Akosua Poku. I am super grateful and super thankful that I got this Nurse of the Year award from the Virginia Nurses Association. I have to tell you guys that when I first saw the email, I thought somebody was trying to play a prank on me. And so I did not open the email until the third one that came to me. And the only reason why I opened the third one because there was a phone number in the email. So I finally called the number and I was told that it wasn't a prank. So I am so grateful. I'm so thankful. It couldn't come at a better time. And as sharing my wisdom with any new nurses or any nurses in the field, the best thing that you can do for yourself is make sure you work with your team and you have good teamwork. Thank you.
Our next winner had a patient come to the ICU with a very grim prognosis. Her only family was her niece, who he arranged to meet outside, both masked and appropriately distanced, but still connected as he briefed her on the situation. He laid the groundwork and rapport to begin the difficult goal of care discussions. He spent extra time trying to coach her through video chat technical difficulties over the phone and never gave up. Allowing this family member to see and hear and be with her aunt helped her grasp the unfortunate situation and allowed her to have a better understanding of her clinical course than she otherwise would have had. Congratulations to Aaron Ross of Riverside Health System. Our next winner wrote an article about the haunting irony of 2020 being the year of the nurse and COVID-19. The many days she spent writing the article was an emotional and cathartic journey, and she did her best to honor the hundreds of nurses she had represented over the years, as well as their unique stories and struggles that only she was privy to in her trusted role as legal counsel. She has remained unwavered in her determination to be a relied upon advocate and resource for Virginia nurses through these difficult times. Her article received high reviews and was picked up for publishing in May 2020 in both of the primary medical legal publications in Virginia, Virginia Lawyers Weekly and the Virginia Medical Law Report. Congratulations to Eileen Talamonte of Goodman Allen Donnelly, PLLC.
Thank you so much to the Virginia Nurses Foundation for this amazing award. Receiving this honor this year means more than you could know. I want to thank my firm, Goodman Allen Donnelly, my partner, Michael Goodman, my associate, Nora Ciancio, and of course, my team, Tracy Drury and Grace Knighton. This has been a team effort representing nurses all over Virginia, and we are so grateful for this award. But most of all, I want to thank our nurses, our clients, past, present, and future. You are inspiration. You are really, truly the winners of this award, and it's been a privilege and honor to represent you. Thank you.
This award recipient has extended her wings to help her nursing college batchmates and nurse coworkers stay fit and healthy during these challenging times. Since the beginning of March, she has been teaching virtual Zoom exercise classes twice a week without missing any, and has asked nothing in return. She's very talented, passionate, and dedicated to helping everyone's physical and mental health. Aside from her virtual piloxing classes, she has also formed a dance group among her college batchmates and practices twice a week in order to present a dance for a fundraising event for the less fortunate nursing students in the Philippines. Congratulations to Maria Tuason of VCU Health.
Hello, my name is Maria Tuason, fondly called Doll. I currently work at the Virginia Commonwealth University's Polyheart Center. I have been in service for 38 years as a critical care nurse. I am honored to receive this award together with 19 deserving recipients in the Commonwealth of Virginia. I would like to dedicate this award to my parents, mostly to my mom, who pushed me to love nursing as a profession. I would also like to honor the Filipino nurses in the U.S. who comprise 4% of the U.S. nursing workforce, but nearly 31% of our COVID deaths are Filipino descent. I salute them. To my relatives and friends who constantly support me, I thank you. Lastly, thank you, BNF, for this wonderful award I shall cherish for a lifetime. I am feeling grateful and thankful.
Congratulations!
Our next winner developed a creative way to allow patients on mechanical ventilators to hear their loved ones' voices. Family members would call and record messages to send their loved ones, and then she and the rest of the team would place the recorders in a stuffed animal that is kept with the patient at all times. Nurses would then play the recording for patients anytime they were in the room. A staff member noted, "The team can't help but believe it was one way the patient's ability to hear their loved ones that played a role to their recovery." Congratulations to Michelle Vaughn of Bon Secours St. Mary's Hospital.
Thank you so much. It's such an honor to receive this award. Yay!
Our next winners unit was identified as one of the primary units for COVID-19 because of the negative pressure private rooms. She immediately responded to these changes and has been a huge asset to the unit as they navigate COVID. The change of space to an ICU and the multitude of research drugs and treatments for COVID. She has shown exemplary leadership, critical thinking, flexibility, and most importantly, compassion during the COVID-19 pandemic. Congratulations to Rachel Weller of VCU Health.
Hi, I'm Rachel Weller. I'm the interim nurse clinician here on acute care medicine at VCU Health. I'm one of the fortunate recipients of the Year of the Nurse Award for the Virginia Nurses Association. I was nominated for my work serving on a COVID unit here at VCU Health as a liaison with the research team to facilitate better and more collaborative efforts to enroll patients in clinical trials as we rolled out multiple medications during this pandemic. I was also highlighted and nominated for my work with the Council on Clinical Inquiry and Innovation, of which I am the chair. That council works to facilitate clinical inquiry processes at the bedside and to equip bedside nurses to do the excellent evidence-based practice that we do every day. I had the fortunate ability to work alongside wonderful nurses at the bedside, and now I'm in a position of leadership to lead these nurses, which is a great honor. Thank you so much.
This award recipient has helped prepare and respond to the epidemic through consultations, inquiry responses, written guidance, and the development of tools and training materials since the first cases of COVID-19 were suspected in the U.S. At the Virginia Department of Health, she co-chairs the Long-Term Care Workforce Advisory Committee, which improves the quality of care in long-term care facilities by strengthening and supporting the long-term care workforce, a caregiver group hit hard by COVID-19 pandemic. She is also a highly valued member of interdisciplinary teams addressing public health challenges both nationally and regionally. She consistently makes a difference every day in her unique and exceptional public health and nurse epidemiologist practice. Congratulations to Dr. Mary Beth White Comstock of the Virginia Department of Health.
Thank you, Virginia Nurses Foundation, for selecting me as one of the 2020 Year of the Nurse Award recipients. I'm truly honored. To celebrate this award, I wanted to take you along with me to some of my favorite places near my home, since I can't celebrate in person with family and friends due to the pandemic.
Living in Virginia's northern neck, we're surrounded by lots of rivers, and there's no place I'd rather celebrate than on the Coratoman River. Another good place to celebrate is on a peaceful local beach. I also like celebrating on two wheels.
From my husband and I, here's to all of the fellow nurses and public health colleagues for your tremendous contributions to the health and well-being of those you care for and serve. Oh, and don't forget these.
And our next winner assisted in the development of the COVID-19 resource nurse role and created many processes for admission, transportation, and care of the patient with COVID-19. She stayed abreast of the rapidly changing literature and guidelines and assisted her team in both understanding and transition. Her passion for palliative and supportive care for COVID-19 patients translated into strong advocacy for changes in the visitation policy. She wholeheartedly embraced bringing visitors back into the patient care environment. She displays resilience, leadership, and strength during the toughest times. She is a rock for the patients, families, and team members in her unit and beyond. Congratulations to Emily Willard of VCU Health.
You gonna know my name. Bright lights, big city calling to my head. Bright lights, big city calling to my head.
Now our final winner worked 17 days straight during the beginning of the pandemic to ensure nursing staff was informed and prepared as they were caring for patients with the virus. She helped to initiate incident command setting up telephones, workstations, and eventually developing tracking methods for COVID positive patients, outcomes, and those waiting for test results, and created a daily communication newsletter for the entire hospital to keep everyone involved in the rapid changes and newest information. She also led a distribution project to centralize the PPE disbursement, regulating access and analyzing the burn rate of use, while keeping the overall burn rate of PPE at the lowest in the healthcare system. Congratulations to Donna Wilmoth of Centera Williamsburg Regional Medical Center.
Hey, keep quiet. We're about to announce Donna Wilmoth as the Nurse Leader of the Year Award, awarded by the Virginia Nurse Foundation for 2020. We're so excited about this. Keep quiet. Donna! Congratulations, you are Virginia Nurse Foundation 2020 Year of the Nurse Award winner. Take your sash.
Cool, thank you.
Dr. Tulp, if you could help me with that, I appreciate it. You also have this wonderful award as a memento of this really esteemed recognition that you've earned. And we appreciate you, Donna, for all that you do.
Thank you, Dave.
Congratulations, Kyle, buddy. Come through this way.
Getting my organs out.
Well, Donna, we're keeping it safe, and in this crazy pandemic year, we just want to really say thank you. This is one of the best things that came out of this year, and we appreciate the recognition for Donna Wilmoth, our very own Nurse Leader of the Year.
Well, this recognition goes to our team here at Centera Williamsburg. So thank you for the great care that we have provided to our community during this pandemic. I am incredibly humbled and honored to be part of this great team.
All right, and we got one last recognition for you. Come on over, Carolyn. Carolyn, a future Nurse Leader of the Year Award winner.
That's right.
So,
Thank you. Thank you.
Thank you. Congratulations. We appreciate it.
Please join me in giving all of our fabulous winners a round of applause wherever you are. I would like to thank you, everyone, for joining us this evening. What an honor and privilege it has been to be surrounded by the very best nursing leaders in Virginia as they lead the way through this pandemic with compassion, expertise, innovation, and tenacity. I would like to remind everyone that every single nurse is a healthcare hero, and we wouldn't have made it through this year without the impeccable hard work, dedication, and sacrifice each nurse has made. So a huge thank you to all of you once again for all you do for your communities. We continue to recognize healthcare heroes every week for their exemplary service during the COVID-19 pandemic. So if there is a nurse, a sanitation worker, educator, or another individual you would like to honor, please submit them to our Healthcare Heroes nomination form and keep an eye out on our social media pages for your submission. Thank you all for participating. Please stay safe this holiday season, and we look forward to the day we can once again see you all again in person.
And congratulations to all of this evening's honorees. And thank you to all of Virginia's nurses for all you do every day. We hope you're able to enjoy a wonderful, safe, and healthy holiday season. Good night.